So my talk is on complementary alternative medicine in the dental field, because just like any form of healthcare, CAM is everywhere. Or the tooth meets the truth. That's stupid, but you know. So this is me, and I encourage anyone, skepticaldentist@gmail.com, feel free if you have any questions, comments, anything. I'm always happy to take your emails. I graduated from the University of Kansas in '82, went to the University of Oklahoma for dental school, graduated from there in '86, and the fellow just shows that I have letters after my name just to impress you guys. You can find me on the Science-Based Medicine blog, like Jamie said. I'm not a real regular contributor, but anytime a dental topic comes up, I try to write about it. And I do hope to host the PRISM podcast along with my new co-host, Clay Jones, who's speaking later on tonight. This afternoon, I mean. So I encourage you guys to tune in. It's a fun time, and I have a lot of great guests, many of whom have spoken and will speak here. And then if you want to follow me on Twitter, that's what we've got. So I guess before we start, I do need to disclose all my conflicts of interest and disclosures so that I'm not called a shill. But sadly, I don't have anything to disclose, and I have no conflicts of interest, and I don't get those big checks that I guess everyone claims to get. So what I think I will do is break down my talk into the two main things that we as dentists see time and time again. And then I have some other little fringe things that I'll talk about. But the two main things, the first is mercury. Mercury. And then the other thing that we'll talk about is fluoride. So, you know, right off the bat, you can tell that we dentists try our best to insert all kinds of toxic chemicals into your body in order to, you know, control you or hurt you or whatever. But so mercury is found in dental amalgams, and those are just the silver fillings that many of us have, especially those of us of a certain age and older. But they get a bad rap because they contain, you know, the toxic chemical mercury. And so you see something like this about how mercury filling almost took my son's life, which is, you know, a scare tactic, and it's a story, and it's a child. And I looked at that story, and basically what it was a kid had a large filling that was close to the nerve. It ended up abscessing, turning into a cellulitis, and had to be hospitalized, and I guess almost took his life. It had nothing to do with the material. It was an abscess that could have happened with any material, but that's what they pinned it on, the mercury. There's some protesters. Look what they did to them. So just as kind of a primer about dental amalgam, it's been used for 150 years regularly, but it goes back even hundreds of years to China and Europe in the 1700s. But it's made, basically, it is 50% mercury, but also there's silver, tin, copper, some other trace metals. And when it's mixed up, the mercury then chemically reacts with those metals to form a very, very stable, hard material. That's placed in the teeth, as many of you know. The anti-amalgam people claim that it causes cancer, Alzheimer's disease, multiple sclerosis, rheumatoid arthritis, chronic fatigue, which these are, of course, conditions that come up time and time again with any toxin, irritable bowel syndrome, and everything basically in the Merck manual. Can somehow, if you Google amalgam and insert your disease of the day, I almost guarantee that you will find it. A lot of research has been done on it, I mean, for over 100 years, and it has actually been shown and been clinically demonstrated to cause nothing. But there are a couple of caveats, because it is true when you hear them say that once a filling is placed in the mouth, it releases mercury vapor for the entire life of the filling, and that is true. It's a minute amount, less than the EPA lesson we get from environmental sources, fish, just atmosphere, just living. So it's a very, very microscopic amount, but there is some truth to that. So the FDA has said in regards to pregnant women and children, because they aren't as able to metabolize mercury and their neurological systems are developing, there's not a lot of research in pregnant women and small children about the effects of silver fillings. It probably wouldn't be ethical to do so. But so since we don't have a lot of data on that regarding long-term health outcomes, including infants who are breastfed, pregnant women, and parents with children under 6 who are concerned about the absence of clinical data as to long-term health outcomes should talk to their dentist. I think that's just taking a better safe than sorry approach. So even though nothing's been shown to cause harm, I certainly wouldn't fault anyone who would just rather be safe than sorry. In Europe, they are starting to scale back a little bit. I think more from environmental concerns, because mercury, the fillings, when it's removed from your mouth, if you have a filling replaced, for example, or placed, it has to be disposed somewhere. And I think in Europe they're a lot more concerned about the environment and not as much with the health aspect of it, although I think maybe Sweden has maybe banned it, but some of the Scandinavian countries have either banned or really, really cut back on its use. The British Dental Association in the UK basically said the same thing as we did over here. There's no evidence to indicate it, that it's harmful, but until appropriate data are available, they concur with the view that it may be prudent to avoid, where clinically reasonable, the placement or removal of amalgam fillings during pregnancy. So again, better safe than sorry. So what about dentists? If mercury vapor and fillings are so bad, what about us? I mean, we're around it all day. I'm around it. I haven't placed a silver filling amalgam in a long time, but not because of the health effects, or just with the composite resins and the cosmetic materials and stuff. To me, there's a lot better option. There are a lot better options. The advantages of silver amalgam: they are strong, they're durable, they're easy to place, and they're inexpensive compared to other options. So they definitely have their place. I just don't do it. But I'm around them all day long. Anytime I replace a filling, we're just kicking up all that mercury vapor. So you would think that if it was as toxic as the anti-amalgamous claim, that it would be the dentists and the assistants and our other team members that would be getting the untoward health benefit or effects. And yes, as you can tell by my speech, I do have a little bit of neurological damage. But when we're not out killing lions with our bows and arrows, we are in the office restoring teeth and exposed to that mercury vapor. But they've done a lot of studies on the health of dentists and the dental staff. And health and morbidity studies have indicated that dentists, we have no unusual diseases, and we do live longer than our physician colleagues who aren't exposed to mercury in their workplace. So physicians die first. So the bottom line, just the take home that I want you all to know is dental amalgam is a safe and effective filling material and poses little risk to you. So if you have a cavity and there are options, don't not choose amalgam because you're afraid it may cause any type of health problems. It's a good material and will continue to be used for a long time. And if a dentist recommends replacing, you've got all these silver fillings and they can cause all these problems, well, run. There are bona fide reasons for replacing them. If you have a cavity under one, if part of your tooth breaks or a new cavity and needs something bigger or different, then you could certainly opt to a different material. And some people come in and they just don't like, fillings look black. They're called silver fillings, but you look in there and they look like black spots on your teeth. So a lot of people come in and they want them replaced for cosmetic reasons. If that's the patient's choice, then there's absolutely nothing wrong with that. There are risks associated with it. Just the act of taking out a filling and putting in a new one there's a small risk of it involving the nerve or needing a root canal and those other things. So it's not risk-free, but usually that's done very, very regularly, and it's a standard operating procedure. So that's the bottom line on amalgam fillings. The next thing I want to talk about is the other toxin that we're trying to poison you with, and that's fluoride. And most of you are probably familiar with Dr. Strangelove, but sapping and purifying our precious bodily fluids. But fluoride is one of our best preventive tools that we have. It's safe, it's cheap, it's easy, it can affect so many people. But here's where the fear mongers come. So let's see a show of hands. Would any of you brush your teeth with lead? When you go buy your toothpaste, do you get the leaded toothpaste? Because fluoride is more toxic than lead and only slightly less toxic than arsenic. So here are the fear mongers. It's on the periodic table. It's right kind of in the same area as some other things that are bad for you, therefore it's bad for you. And for them to really hit that home, they will make there. So, on the left, fluoride is a poison. Okay, there's the sign. If you don't get that, let's highlight it in yellow, because then fluoride is a poison. It's a highlighter, so you pay attention to a highlighter. Does that not get you? Let's just slap a swastika on it. Because, if you go just from fluoride is a poison, then you're into being a Nazi, then it must be true. So that's how you know they're serious. So just a little history of water fluoridation. It was going back to the early part of the 20th century in parts of eastern Colorado, western Kansas, that area. It was noticed that certain people were developing these kind of brownish, whitish spots on their teeth. They called it mottled enamel back then. And they were trying to figure out what caused it. So they went out and they did all the research and lab tests on the water and other environmental factors, and they eventually determined that it was the fluoride. That Colorado has a high natural level of fluoride in the water. But they also noticed, and in too much fluoride can cause some unsightly mottling of the enamel, dental fluorosis, and it is a cosmetic defect, but it's not a health hazard. It's just unsightly. But they also noticed that the people with the dental fluorosis were relatively cavity-free. And this was back in the day when just tons of teeth were lost to decay all the time. It was before, obviously, fluoridation of water, before the preventive measures we have now. And so, most people had no teeth by the time they were 50, 60 years old. So they noticed that there was a great preventative for dental decay. So by the time they'd done the research and gone through the science-based process, they added it to the water in Grand Rapids, Michigan, in 1945, and they followed 30,000 school children for 15 years. And they found out that it was dramatic, 60% reduction in tooth decay. And that is significant, because not only, if you're thinking about your own history, it's like, okay, I didn't have to go to the dentist as much, but you're also talking pain and suffering and time missed from work and costs and all that. So that is profound. The optimal concentration in fluoridated water, municipal water supplies, is around 0.7 parts per million. And that I say around because they will change it based on climate, warmth. It used to be 1 part per million, and now just recently they've lowered it somewhat because it confers the same benefits, but the risk of the fluorosis, the little spotting on the teeth, is reduced even further. So it's a happy medium. So that's some history. So a little chemistry for you. Tooth enamel is roughly 96% an inorganic crystal called hydroxyapatite. And that's what you see on the left. And when fluoride is placed either in the water or in your toothpaste, when it's absorbed into the enamel, the fluoride ion replaces the hydroxyl ion on that, and it makes the fluorapatite a lot more decay resistant. Acid resistance, it's a lot less soluble. And the rest of the 4% of enamel is about 2% organic material and 2% water. So it's mainly just a crystalline structure. And that's why once a cavity starts, despite what you might read about reversing decay and things like that, for all intents and purposes, once it's gone, it can't repair itself. So fluoride allegedly causes cancer, lowered IQ in children, ADD, ADHD, Alzheimer's. It will calcify your pineal gland. That's a big one. And that's, of course, where the seat of the third eye is or something. I can't remember. So you don't want that calcified. And then everything in the Merck manual. If you Google fluoride plus disease of the day, you will also find something. And apart from the cosmetic blemish, the dental fluorosis that I mentioned, fluoride has really been at appropriate doses. You can overdose on fluoride, absolutely. And there have been industrial accidents where they're dumping it into the water. That doesn't count. But fluoride has been shown to really cause no issues. It's a safe and effective. So here's some fluoride facts and figures for you. So right now, approximately 3/4 of the U.S. municipal water supplies are fluoridated as of 2012. I think it's a little bit higher now. And I don't know where Canada falls. I don't know where the countries in Europe fall, but that's where it is in the U.S. And even today, with all the other preventive measures we have, sealants on kids, fluoride in our mouthwashes and toothpaste and professional applications at the dental office, there's still 25% additional caries reduction conferred because of fluoride in municipal water. And the CDC proclaimed it as one of the 10 great public health achievements of the 20th century. So that's right up there with smoking, discovering that smoking causes cancer, and safer childbirths, and invention of antibiotics. So for the CDC to proclaim that, I think is a testament for the public health benefit it has. And this figure is bandied about. I don't know how true it is, but this is what we say. For every dollar spent on fluoride, it prevents $38 in dental treatment costs. And also the wonderful thing about fluoride is if it's in the water, even though the anti-fluoridationists will say that it is forced medication and against your consent, but it reaches all populations. And sadly, the population that really benefits from it the most are lower socioeconomic status areas that may not have access to care, maybe don't have a dental home, and perhaps their diets aren't as good, so they're more prone to decay. So this is such a wonderful public health measure that benefits everyone. So that is fluoride. And so in the dental office, we have a few other fringe dental topics. Unlike medicine, where if you have cancer and go to a quack cancer doctor, I mean that's a difference between life and death. Fortunately, most of the stuff that we see, the what's the harm part isn't quite as profound because it's not a life or death. Yeah, maybe maybe if someone doesn't have fluoride, they're going to have more decay and stuff like that, but that keeps me in a job. But one of my favorites is cranial osteopathy, which is just such a great dog and pony show if you ever watch it. The premises behind cranial osteopathy is that by using light pressure, the operator can manipulate the cranial bones and separate the suture for some outcome. Now, I don't know if I really can't see the audience. I don't know if we have any neurosurgeons, oral surgeons, neurologists, but I've spoken with several of them, and they said without exception that if they ever see a patient whose cranial bones or facial bones are separated at the suture, that's a traumatic, it's because they've hit a brick wall in a car or something, or gotten the wrong end of a baseball bat. It's not because some magical operator has manipulated them. So here is a video I want to show you. This is of an actual continuing education course for dentists, certified by all the, that would count toward my requirements, showing how to manipulate a skull. So try not to laugh.
And then we're going to inhale, and we're going to come straight towards us, and all of this squamous area shifts. And then we're just going to move this whole facial system side to side. Good breath in and out. I'm going to go away.
Listen to the reaction.
No.
In.
You're kidding.
Out.
Is that the soft tissue?
Holy crap.
No, it's
That's the entire maxilla, like a windshield wiper.
No, come on.
Look at that.
Jesus.
That's the windshield.
No
wiper.
way.
Yeah.
Oh, man.
No way.
Those don't move.
See
see those facial bones move? Isn't that crazy? And there's one skeptic in the group, you heard that, and that wasn't me because I wouldn't even sign up for that course. But they're shouted down, like, no way, that's just the soft tissue. No, it's not. So when I got that video, maybe a year or two ago, I got my hygienist and my assistant and had them watch it. And my hygienist is a very science-based individual. My assistant is amazing and wonderful, but she has really no medical training, not much science training. So my hygienist was the patient and my assistant with no training or education whatsoever. So behold cranial osteopathy in my office. If I could figure out a way to charge for it, I could dupe a lot of people. Now we're running. Yeah. Look at that. Look how her facial bones are being manipulated. That's amazing. So just for those of you who have never peeled back the layers of your head and looked at the skull, the sutures are so intricately interwoven. I mean, it's just a zigzag, microscopic jigsaw puzzle. And, you can move the cranial bones a little. You can flex them on the order of about 10 to 30 micrometers. I mean, so undetectable. So with that, cranial sutures can only flex a little bit, and they can't be separated. You can't unlock that unless you use a baseball bat or and even if they could be manipulated. So let's just say that guy was doing what he was doing. Well, it doesn't necessarily follow that anything good would come. Do you just move them around and say, okay, see ya, thanks? But that's kind of a chiropractic worldview in dentistry that we see. That somehow manipulating something, and I'm sure for some people, the patient will even say, oh, I feel so much better. Some of the other fringe topics are toxic root canals, dun, dun, dun. And I don't know if our esteemed colleague, Dr. Joe Mercola, is speaking later today, but if you may have seen on his website, 97% of terminal cancer patients previously had root canal procedure. Well, that came out. Then, of course, the news agencies picked up on it and press releases, and I had several patients ask me about that. Fortunately, most patients can detect BS when they read it. First off, that's absolutely false that happened, and second, 97% of terminal cancer patients probably, drank a soft drink or milk. So correlation doesn't mean causation, as you know. So the premise of that is a root canal is usually done when a tooth gets infected. So we go in and clean out where the nerve used to be and seal it up, and the infection is resolved, and the tooth lives happily ever after. The premise is it's impossible to completely sterilize a root canal system. So no matter how good it is, there are always going to be bacterial byproducts, endotoxins in there, and that's going to create some systemic problems. And they base most of the research on research done in the 20s and 30s. Weston Price is often cited as a pioneer in that. And back then, for one, the root canal procedure then was so primitive to what we do now. So that's like saying, well, we shouldn't do an appendectomy because I read a journal in 1830 and they died a lot. And then second, that was in the pre-antibiotic days. So, a lot of times when it's indicated, we combine root canal with antibiotic therapy. Here's kind of a fun one, acupuncture. Dentists are claiming to do some procedures with acupuncture. This guy is actually an acquaintance of mine. He wrote an article in a throwaway journal that we get, and he put it, that little yellow thing is a root canal file, it's an endodontic file. So that's what we go in and we clean out the tooth. And so this patient was a gagger. When they take impressions, a lot of people have a gag reflex. And so we read somewhere that there's an acupuncture point called the It's the conception vessel meridian, as you all know, the CV24. And so he didn't have any acupuncture needles on hand, so he got the next best thing and stuck it in the guy's chin, and allegedly his gag reflex went away, probably because of the intense pain in his face. And then he wrote it up in a journal. So, big deal? No big deal at all. But when that goes across, 100,000 dentist desks, how many people are going to read that and buy into it and think, oh, there might be something to it? This has made the rounds lately, oil pulling. Swish with coconut oil for 20 minutes. So if anyone can do that, let me know. Here's all the benefits. It whitens your teeth. It strengthens your teeth, gums, and jaw. So for those of you who work out and need good, strong, jaw guns, oil pulling. It prevents cavities and gingivitis, which I don't know. I haven't learned that. That must be a new thing. So bad breath, headaches, hangovers, which tomorrow you guys can swish. Quality of sleep, detoxifies the body, zits, hormonal everything just from coconut oil. And again, if you want to swish with coconut oil for 20 minutes, go ahead. The mechanical action of swishing with anything that doesn't have sugar in it and is not acidic is fine. It's not going to hurt anything, but God, would have to taste terrible. So parting thoughts, if you go to a dentist and they recommend anything that just, your crap detector goes off, don't hesitate to question him or her. Why are you recommending this? What is your evidence? If they're worth their salt, they will be happy. I like it when a patient challenges you. Why would you do this? What are my options? Because that means that they're involved in their own healthcare decision, and I welcome that. And so ask for evidence. The best resources that you can check out, the American Dental Association has a fantastic resource for healthcare professionals and lay people alike. It's part of the ADA.org website, but it's the evidence-based dentistry.ada.org. And you don't put www in front of it or it won't take you there. So it's just type in ebd.ada.org. It's you can look up systematic reviews, position papers, anything you want to do, type it in and it'll give you, it's a great database. Science-based medicine, of course. CDC has good resources about dental health, dental care. If you're from across the pond, the Sense About Science people, the Good Thinking Society, Simon Singh's organization, they're getting more into the dental arena and have some good science-based dentistry. Like Jamie said, we'll be taking questions at the end of the day in our panel. So please if you see me out in the hall, please track me down, email me, find me out in the hall, come to the panel tonight or this afternoon and ask questions about your tooth curiosities. And that's it. Thank you guys so much.